is our objective to really push forward the technology, the medical discoveries, the methodology for delivering health care on the part of state, so that there is a greater sensibility to protect mothers and to prevent that children be born sick.
The issue of testing is important. Our messages have to go out to the research and development organizations, the universities, the pharmaceutical companies, to manufacture tests that we can get that gap narrowed. This is something that we can do. This is something we can contribute to. This is something we can really latch on to.
The Catholic Church and the faith-based organizations in general are major partners in prevention and care. And especially for this area of HIV prevention, life-to-child transmission, the faith-based organization and the network of the Catholic Church and Christian churches are extremely important.
Even some AIDS patients, after that, they couldn't go to the church because some priests were afraid of HIV or because of stigma and discrimination. So he started to advocate and to raise, to ask the religious congregations to involve and to raise awareness about HIV/AIDS.
It's a very important practical piece of partnership between the US Embassy to the Holy See, Caritas Internationalis, UNAIDS, WHO, and a whole range of other partners, both faith-based, UN and government.
How will this person be fed when they begin to feel better? We have then to try and source funding for the food. We then have to source funding for income-generating projects and training. We have to provide the transport not only to the distant remote healthcare, but for the mobile program that goes out every morning and puts up chairs and tables under trees.
HIV testing is central to the intervention. We need to do prevention of HIV and need to care and support.
I think we have to talk about programs. And because projects are, to me, it's a very limited word. And of course, we need to have also something that lasts.
Bambino Gesù is a very special mission because it's a unique hospital, actually. It's the hospital of the Catholic Church. That by treating, you realize in the same time prevention. We started from disease of children, and now we have healthy children.
We believed that we could make a difference by taking little steps in some remote areas of our missions when we put together what each one can do for our global community.
Because we still do not have universal access to treatment. With children, if we look specifically at children, the programs of the Catholic Church are attempting to put a number of services in place.
Vogliamo fare della prevenzione soltanto in modo tecnico, ma riteniamo di avere un compito etico assolutamente fondamentale nel ridire alla gente che è importante vivere con uno stile di vita che noi riteniamo adeguato.
And not only do we need to work with many other groups in building partnerships, I agree with that certainly, but I do think we have to work with ourselves to build partnerships as well. We need to find ways to work together to raise our voices with and for those people living with HIV and AIDS, but most especially for the children who are living with HIV and HIV and TB co-infection, and also to make sure that that kind of transmission of infection does not happen in the future. As we can raise our voices and we can promote effective action together, because we cannot do it alone.
Prevention of mother-to-child transmission starts with the testing and counseling of pregnant women. When it comes to the infant, however, detection in the infant is a bit different. Then, in the event that that's positive, we look forward to seeing treatment and monitoring for that infant as well. These are the people on the ground and working on the policy that will make it happen.
We developed a new platform called the Green Light Committee that allow countries that follow certain criteria, that have a good project and program in place, to access to drugs at a very discounted price. That was really the beginning.
Possiamo fare di più, dobbiamo fare di più. Come? 4 punti fondamentali, estrema concretezza. Innanzitutto, essendo più flessibili nei confronti della proprietà intellettuale. 2, essendo più flessibili sulla politica dei prezzi. 3, cercando di essere più aperti nelle collaborazioni per combattere le patologie nei paesi in via di sviluppo. Il 4, cercando di diventare e quindi di smettere i panni del fornitore di farmaci per trovare insieme delle soluzioni. Possiamo fare di più, dobbiamo fare di più.
Let's gather our forces and spread out everywhere.
What a game!
To beat tuberculosis, we need support from all people and all governments. The world is in danger, and we must win this fight.